I'm here with epidemiologist Bonny Specker, who is going to give us an update on the COVID-19 situation across our region, in the state, across the nation, and in the world. And Bonny, what do you have for us today?
Well, thanks, Chelsea. I was going to talk a little bit about the mortality data that the state has released, both by vaccination status and also the 2021 mortality data, and give an idea about excess deaths, which we've talked about before. And then the big thing is the new CDC measures of COVID. And this has affected the slides that we usually do every week. And I was just going to show people a little how I'm trying to incorporate that. It's still kind of up in the air because the Department of Health hasn't figured out how they're going to be presenting that on their dashboard. So things are sort of in a state of flux, but I'll give a little bit more information in a second on that. And then we'll talk about the other data. This is one of the reports that the Department of Health has just released, and the website for this report is given here, the link. But what this is showing is the death rates since June of 2021. So this is primarily the end of Delta and then Omicron. But you can see that these are the death rates among vaccinated individuals at these different age groups. So the 18 to 49 up to 75 plus. And then these are the unvaccinated people. So you see a much bigger effect out here in the older age of the vaccine. And you might say, well, there's no effect here, but there is a difference between 1 and 12. It's small, and I don't even know if it would be statistically significant because so few deaths do occur at that age, but there still is a benefit on mortality of vaccination, even down in that lowest age group. So this is one of the graphs they present. They also give some data or graphics looking at the median age at death in people that are vaccinated versus people that aren't. And it's something like 80 years if you're vaccinated versus maybe in the 60s if you're unvaccinated. But that graph is on this website. And they also categorize the state into the different counties in the state as a low or medium % vaccinated versus high vaccinated. And then they look at the mortality from COVID in the low and medium counties versus the high counties. And that graph is also there. The other thing that came out recently, back on February 16th, was a full year for 2021 mortality data. Now, this is provisional. They do review this and they give a certain amount of time to make sure all the death certificates are submitted before they finalize this death information, the Office of Vital Records. But what you see, this blue, this bunch of colored lines down here are the years 2010 to 2019 and how many deaths per year for these different months that you normally see over this time. This blue line was 2020, and when this is with COVID first coming out back in March, and the deaths are running higher even back in here, but then they really take off in November of 2020, and that's when we had that big peak. And it shows up here in January. We still have quite a few deaths occurring, much higher than what we had in the previous years. And then this is the last half of 2021. You can see that we're quite elevated. This is with the Delta variant and the Omicron. And this is really, I think, sad because these are the deaths that could have been prevented through vaccinations. You know, back here in 2020, we didn't have the vaccines, but here we do. And a lot of these deaths could have been prevented. If you look at the total number of deaths, this is in 2020, 2021, We have over 9,000 total deaths in those 2 years. If you look at the average for 2010 to 2019 before COVID, we were having about 7,600 deaths per year in the state of South Dakota. If you subtract that 7,602 from this, you end up with 2,255. So that's how many deaths above the average occurred in 2020. In 2021, that number was 1,571. Now, if you look at what was coded as COVID deaths, in 2020, it was 1,497 deaths were coded as COVID. And in 2021, it was 774. So if I subtract this from here, I come up with excess deaths that are not coded as COVID, okay, of about 700 to 800 in 2020 and 2021. Now, these deaths here could be a result of a lot of things. One of them could be that they are COVID related and just didn't get coded as that. Another one could be a delay in people getting health care when they needed it. And another possible explanation is that during those peaks when the health systems were overwhelmed, that there was sort of insufficient care or resources to provide care for people that had other things other than COVID. And again, we did a video a while ago on excess deaths and talked about some of this, but thought that was interesting. So here's the new CDC definition of community levels. And there's 3 different indicators that are used. One of them is this new cases per 100,000 people in the previous week. Another indicator is how many new admissions, new hospital admissions on a population basis were during the previous 7 days. And then the third indicator is what percent of staffed inpatient beds are occupied by COVID patients, trying to get at hospital resources or capacity. So the CDC has done a map of this by different counties. And I'm a little bit confused right now on how they handle the county data in South Dakota. And the reason for my confusion is this percent of staffed inpatient beds. If you do that by county, there's a lot of counties that don't have hospitals. So how are they coming up with the number to determine what this indicator is for that specific county? If they're doing like Brookings, if they're using Brookings Health System as the one hospital to establish this indicator, that's not necessarily good because so many people are transferred, especially with COVID, to Sioux Falls hospitals. Now, the Department of Health actually categorizes the counties into regions in order to look at health hospital capacity. And Brookings is in the Sioux Empire region. So I thought, well, we could use that. But if we use that, we're not consistent with what the CDC is calling us. So I can't figure out what the CDC is using. And hopefully when the Department of Health updates their dashboard to incorporate these indicators, it'll give us a little bit better idea of what it is that they're using. But because of these new recommendations or these new guidelines, I thought I would redo the graphs that I send out each week, sort of in this format. One of the other things I want to mention before I show you those graphs is that the CDC website that's linked here also gives you sort of individual protections or interventions that you can do, behaviors, both at the individual level and at the community level for this low, medium, and high. So I didn't put that on here because it's just a big list of the different recommendations of what people should think about. But there is this link that will get to people to that. So as far as the graphs, I have revised and updated quite a few of them. And then I also deleted some of the slides that we normally have in the weekly summary. And that includes the slide on percent test positivity, because that is so dependent on how many tests are being done in clinics. And now with the home testing, it's not really clear what it means anymore. Same with new cases, actually. But I still give that data because that's all, it's one of the few things we have. I also deleted the slide that has the percent of the population that's received at least one vaccine for the 10 counties with the most populated cities. And the reason I did that is, first of all, they haven't been changing much. And second, having just one vaccine hasn't really been shown to be very effective against Omicron. So it's sort of a poor indicator of what percent of the population's actually been fully vaccinated. And that slide that I have by age, that's still in the packet, the weekly packet of slides. So here is one of the new summary slides. So this is trying to get at where Brookings lies right now. If you look at the CDC map, it's showing Brookings County as low. But if I look at the actual data that's on the dashboard, in the past 7 days, you have to adjust these for population size. I think we had 8 new cases. That comes out to 23 per 100,000 population if you do the calculation. That's assuming this population size for Brookings. So that would put us here. If you look at the new hospital admissions in the past 7 days, it's 5.7. I'm sorry, that's what puts us here. But then if you look at the percent of staffed inpatient beds that are occupied by COVID patients, it actually is 10.8 for that Sioux Empire region, which would put us into a medium level of spread, not this low. So again, all what I have is what's on the dashboard. We'll have to wait till that gets updated to figure out how they're going to be consistent with the CDC guidelines. If you look at what DOH is saying about Brookings County right now, and this is still based on test positivity and the number of new cases, they still have us in moderate spread, not low, but we are definitely getting better than we were a month ago. Here are the data. You see this rapid decline. I mean, we're quite low. This is the new definition. So if you were below this red line, we could be in low spread, at least for this particular indicator. And if we're above that red line, we're going to either be in medium or high. So we only had 8 cases last week. We had 18 the week before. That's compared to over 600 a month ago, or 2 months ago. So it's really dropped quite a bit. And this past week, it actually looks like, more than half the cases are in the older people, which is not really a good sign since the outcomes are worse in that age group. And if you look at the rates, here's that that magical number of 200 new cases in the past week for that new one. And you can see that all 10 counties have now dropped down below 200 new cases per 100,000. So that's a good sign. Again, we were way up here not that long ago. But if you look at the hospitalizations, we're still kind of up there. And I'll show you some data towards the end of this that makes me just a little bit concerned. I wish that if we really have that low number of cases, we should be having a lot fewer hospitalizations than we do. And to me, that's indicating that some of that decline in cases could be due to the home test kit. And again, here I've added this currently staffed percent of beds that are occupied. But it is gone down for the last month. We've been having decreases in hospitalizations. And we had no deaths last week, which is also good. Yeah. So if you look at the state, now here the data are consistent with it being low. The CDC doesn't do it at state, they actually do it by county, but you can see we have fewer than 200 cases per 100,000 population. Our new COVID admissions are 1.1 per 100,000. And if you look at statewide, only 6% of the staffed beds are COVID occupied. So, in this case, we're in this low category for all of those indicators. Now, here at the state level, there were 515 new cases last week compared to 1,849. Again, you're seeing these new cases in the older population. And one of the things that I just wanted to mention is that this past week, it looks like the Department of Health, because we do have so few cases, that they're going and cleaning up a lot of their data, because some of the numbers aren't matching. Like if you look at one where you're looking at it by age and you total up the number of cases, you're coming up with different numbers than if you look at the total overview. And that usually happens when they're in the middle of a data clean. And you see it especially in the hospitalization data. So it'll probably be a week or two as they're cleaning this data to get things back on track. And here's the hospitalization data. You see this really tiny number down here, but I couldn't even calculate what the age distribution of these 10 cases were, because there were a lot of negatives in different age groups, which is telling you that they've identified someone that maybe wasn't a resident of South Dakota and they have to take them out, or they maybe have entered a wrong age and they had to put them, move them from one age group to another. So things in the database are shifting, and that is perfectly normal. Again, it's not like they're trying to snow someone over with this. It's a common, no data. It takes a lot of work to make data as clean as possible. And this is just showing that DOH is trying to keep those data sets cleaned up. And now that they have a little bit of time after that peak, they're doing it. If you looked at the number that's hospitalized, we have 147. So this has dropped. The ICU number also dropped just a tiny, or actually went up a little bit. I added this bar graph. This was the first week of that, and that's where we're now going to be tracking the percent of staffed beds that are COVID occupied at the state level. And so that's 6.2. And these breakoffs here are for that particular variable. If you look at deaths in South Dakota, these haven't really dropped much. We either have 24 or 30. Again, this is a confusion on the database, but they do list 30 if you look at the age distribution, how it compares this week to last week. And that will probably be fixed by next week. Now here, this is the thing that has me kind of a little confused, or thinking that a lot of this decline in new cases is actually a result of home testing, is that you do see this huge decline. This is over 2 months. We've gone from 5 million cases a week down to half of a million. But if you look at deaths, these have not declined So here's the cases and here's the deaths. If it's been 2 months since we started seeing that decline in the cases, that's about the same time that a lot of the home test kits started coming out. We should be seeing those even with that 3-week lag that everyone talks about. This should be dropping more than it's dropped. And so that's one of the things that has me waiting to see what happens in the next couple of weeks. Here we have worldwide, a decline in the last 5 weeks. And in the last 4 weeks, the deaths have been declining. This is more consistent with what you would expect with that lag. So my little thing today is to be kind to each other and also to yourself. But it does look like things are getting better. It'll be interesting to see how the DOH does the new dashboard.
It will, and we look forward to seeing those numbers. Thank you so much, Bonnie. We'll see you in about a month.